All right, we're going to call the Health Board meeting for April 16th to order. Dr. Ryder couldn't be in-house here at the council chambers today, so he asked me, this is Peter Zaleski, to run the meeting. We're going to start off by just doing a roll call, so if you can just say aye as I run past your name here. Jeff Butler.
Aye.
Robert Coddington.
Aye.
John Iggleman.
Aye.
John Lebo.
Aye.
Sabrina Pennington.
Aye.
Paul Ryder.
Aye.
And myself, Peter Zaleski. We're all here. And here also at the Annex Building is Christine Stenson, Dr. David Jetmore, and our attorney, Ron Cross. We're going to start with the minutes. Everybody get a chance to review the minutes from our previous meeting?
Yes.
Is there a motion?
Yeah, this is Iggleman, and I make a motion that we accept the minutes as read.
Is there a second?
John Lebo, I second.
Okay, so we have a motion to approve the minutes by John Iggleman and a second by John Lebo. We'll do a roll. Any questions on the minutes? Hearing none, we'll do a roll call vote. Jeff Butler.
Aye.
Robert Coddington.
Aye.
John Iggleman.
Aye.
John Lebo.
Aye.
Sabrina Pennington.
Aye.
Paul Ryder.
Aye.
And myself, aye. Next order of business is the health officer reports.
Well, the coronavirus number of positives in the hospital right now is 20. That's up from 19 a couple days ago. I think we're starting to see a top to this peak. Things are leveling off, and there are hopeful signs that this may be beginning to taper. I think it's interesting. It's very hard to compare counties because of the different populations, but I think a more telling statistic is the number of infected people by per 100,000 population. And by that standard, Wayne County is doing incredibly well. I think we've got a map up that shows where we're at. We are experiencing this at a rate of around 29 per 100,000. And for comparison, Marion County, where Indianapolis is it has a rate of, how much is it?
They have 339.
339 per 100,000. So you can see the virus has penetrated that population 11 times greater than it has the population of Wayne County. And if you look at that map, you can see that we're surrounded by counties that have a much higher incidence of coronavirus by population comparison than we do. So, and I think that's true if we had the Ohio counties. They are much higher all along the Ohio line. So we're kind of an oasis as it now stands. So I think this is due to the fact that we have instituted pretty clear directives for the population. And the reason we're experiencing this success is because of our citizens. I mean, the doctors aren't doing this. We aren't doing this. People are taking these social distancing and staying home unless it's totally needed to leave seriously. And so this is kind of a tribute to the people of Wayne County. I think, did she leave?
just for a moment, I believe.
Okay. I think Christine wanted to talk about a plan for our homeless population, and I don't think we have a plan in place at present. But does anybody have any specific questions about the coronavirus epidemic in the county up to this point?
This is John Lebo. I have a question. Do we know anything about the nursing homes in our area?
Yes, we do. There was a question in one of our nursing homes. One of the healthcare workers there was ill, and they had isolated 5 patients there. So we asked the strike force from the Indiana State Department of Health to come out and look at this. They tested 10 of those patients, and all 10 were negative. They also were concerned about another nursing home and went there, and I don't know the results of that visit yet. This was called in by one of the healthcare workers at the nursing home for one ill patient, and that patient was probably tested, but I don't have the results of that test.
And that was just done yesterday, so those tests probably will not be till late today or tomorrow would be my
there's
best guess.
At least a 24-hour turnaround.
Thanks a lot, Doc.
And there has been at least weekly conversations with Dan and Dr. Huth, and have you been on those calls with the
Well,
nursing facility?
we meet and have for, it seems like forever. We meet at 8 o'clock every morning for a Zoom conference call, and this includes Dr. Huth, the principals at Reed Hospital. So we're able to keep up with what's going on with Reed, with ventilator use, testing that they're doing, and on that same call are all the county health officers or people involved with county health in all the counties surrounding us, all our adjacent counties, including Franklin County. So, yeah, we've kept abreast of this thing as it has unfolded.
Good job.
This is Bob Covington. I have a question. Will we in Wayne County not get more tests widespread, or is that 6 weeks down the road, or will we be limited in our testing for the asymptomatic, or whatever that word is, coronaviruses? How are we doing on testing supplies? I see the state says they've got enough. I see the feds, obviously they say everybody's got enough. And I see we still have 150 that we have to ration out. Is that correct, or am I misled now?
Well, the testing has, the availability of testing has opened up. I asked that very question this morning to the people at Reed, and they said that they could do 1,000 tests a day.
Oh, good.
So.
Oh, wow. So that is that. So our first responders and our nursing personnel are being tested.
They are being tested or can be tested. We have the tests. When we say we test 1,000 people, I'd like to test 65,000 people. I mean, we need to do widespread testing for many, many citizens, and that's going to have, before we can really unwind this thing and let people return to work and return to normalcy, we're going to have widespread testing. We're going to find people that had this disease that didn't even know they had it.
That was my point.
There's a lot more coronavirus in the community than the 20 positive cases we have for this county. We know that, but that's been true for all the other counties. The only place in the state where you can be tested for coronavirus is in Indianapolis. although I heard this morning that they are recently going to do testing in South Bend, Indiana. So the testing is finally starting to ramp up, but the gold standard for this test is identifying the virus itself. The virus is recovered from a sample from the nasal pharynx, from the very back of the nose. Then it's put in a test tube, and recently we had to have a certain reagent to put this virus in. We would run out of this reagent. That would limit the test. Now the state and private labs say we can use saline, which is just salt water. So that's helped us. Anyway, this virus or RNA is replicated over and over again, sometimes 1 billion times in a 2-hour period, and then markers are put on it, and it's a very complex test. It's easy to screw it up at some step along the line and have to start over. I think ultimately we need an antibody test. That test is becoming available, but it's problematic with a lot of false negatives. But ultimately, we need to get to a point where we can do a simple blood test, a blood stick, have an answer in 10 or 15 minutes. That we're going to find many people who have had this virus. And that bodes well for the future because as the pandemic goes on, especially as some people say it might recur in the fall, we need to identify these people that already have had the virus and hopefully will have some immunity. We don't know for how long, but these would be people that would be certainly the ones that are going to help start the economy to move forward again.
On the testing, it's not anybody once tested, where it's not at that point, but the tests are not requiring state approval before they go, and there's some sort of triage and questionnaire before they're tested. Is that correct?
That's right, Pete. They before they had to get a number. You had to call and get a number from the state. Once you got that number, and the state would not issue that number unless you met certain criteria. Now a doctor can order this test if he suspects coronavirus, and the test will be performed.
So that's improvement even from our last meeting that we had.
Yeah.
It was requiring the state approval for every single test.
This is Paul Ryder, and that occurred just in the last week. Give an example of the importance of screening, though. One of the New York hospitals reported in the New England Journal that they just started screening all people being admitted in labor into their OB unit, and they admitted 215 women. They screened them all. 4 of them were symptomatic, had symptoms of COVID-19, and all 4 tested positive. But the shocker was 29 women tested positive for COVID-19 with no symptoms.
No symptoms. Wow.
And so I think you can see for hospitals and such, that's a dilemma, because if they hadn't known about those 29 women, they could have spread it around the ward.
Yeah, you could have.
And so that's kind of the scary thing, and why we really need a lot more testing. And we're getting there, but we're not where we need to be yet.
Has there been any movement in this area for the quote-unquote rapid test, or, is that still hotspot specific?
We're getting, Reed has gotten the reagents to run a more rapid test so that they can, set it up and run their controls. And they have put in request, but we're in line because and so the hotspots are getting priority over us. So it is going to come, but at least my impression, and Dave, correct me if I'm wrong, is that we still don't know an absolute date.
No, we don't. I think one thing that's interesting, Paul, on the treatment front is we can use convalescent serum to treat these people with COVID-19 infections. And this convalescent serum, if you have if you've contacted the disease and you've recovered, you're a couple weeks out from recovery, you can donate a unit of blood. The blood will be spun down and the plasma separated from the red and white blood cells, and this can be given back to the patient. But that convalescent serum can be used to treat people who actively have the disease. And this is, Reed Hospital is in a protocol with the Mayo Clinic, so we can do this, and this is really the first time we've had anything therapeutic, I mean really therapeutic to offer our patients other than just supportive care.
Any other questions on coronavirus update?
Do you want me to talk about the homeless
Yeah.
population? I think that it's important to as we are expanding testing, when I look at our plan for a pandemic that Wayne County has had, there's no provisions in there for the homeless population. And as we start expanding testing and we come across a homeless person, we don't have anywhere to put them. And on our task force, we've brought this up at the task force meetings, that this is something we need to address pretty rapidly. We've reached out to Red Cross, they're on our task force, and so it's something that we need to look at. Where will we put the homeless population that we are going to put into a 14-day quarantine? We don't want them just meandering around the community, and it's a special population that we need to figure out what we're going to do with them. We did reach out to Delaware County, who has kind of a District 6 organization called Bridges, to see if we couldn't get an MOU with them. That is where we would put them. So we're trying to figure out who has responsibility for the homeless population of Wayne County. So that's kind of what we're in talks with right now. But I wanted to bring that to the board's attention, that was not in our plan for a pandemic of housing the homeless population. So.
Christine, John Lebo, where do we stand with the needle exchange? Have you had a report from them?
I do. The needle exchange has been suspended since Chris is here. When did we suspend that? Early March?
March 19th.
March 19th.
Okay.
But the state has
Good to know.
Yeah. The state has given some direction on that, and we'll talk about this under new business, the emergency plan for SSP to open back up. So we have been in talks with them.
Thank you.
Yep.
Now, this is Paul Ryder, and I noticed that some states or communities are using their excess capacity in their motels to help with that homeless housing situation. Have we explored that at all?
Yes. We explored that, and there was no interest. So we've reached out to several different entities asking for help with that, and if they had any capacity to help the county, and so far it's been no. So that's why Bridges had reached out and through District 6 to say, let's talk, see what we could do to help Wayne County out. So I appreciated them reaching out to us. Right now, we just don't have a plan. I think I have my mask on too tight. I think I'm getting lightheaded from my mask.
That will do it every time.
I know. I'm telling you, I'm hardly able to breathe in this thing. So I think that's what made me get lightheaded and everything. I'm breathing in my own CO or something. So that's where we're at right now. I just wanted to make the board aware that we are talking about that. It's on our radar, and as we continue to go through this with we meet with our task force every Monday, Wednesday, and Friday at 2 o'clock, and we have Red Cross on there, we have EMA on there, the county commissioners are represented, the county council, city council, the mayor. I can't even, fire, police, we have everyone on that. So this task force has been aware for a little while, and we've been talking about it and trying to move through it. I just was bringing the board up to speed on that's what we're in the talks with.
You're keeping busy.
Yeah, I've been busy, earning my keep.
You are.
So,
Any other questions related to that for Christine?
Yeah, this is Dr. Ryder. I assume Reed is on that same task force?
yes, we have Ryan, he calls in on that.
Okay. Reed has some excess capacity as far as the old Connorsville Hospital.
Oh, that's good news.
So, but they're thinking about if they have to, something they may use if all of a sudden there's another surge.
Right.
But I don't know if that's another option to look at for the temporarily housing homeless that have to be isolated, or if they were positive.
Yeah, they haven't offered it up to us.
Might ask. They may say no, but
Yeah. I think Dan has asked,
okay.
but I'll ask again. I like the thought of bridges being a regional resource. I think that a lot of times we forget about using regional resources. There's no sense in everyone having something for just a little population when one, if we could send resources to bridges, for our homeless population, and they provide the facility, that may be a better avenue for Wayne County than us trying to house our own, quarantine area, for just a few. So that would be my recommendation, is us look more of a regional way to have quarantining until we see that get overwhelmed and things like that. So that's kind of the way that I see us going until we reach capacity, with the regional resource.
And this is Paul Ryder again. I think that makes sense.
Any other comments, questions? Moving on to the next agenda item, the attorney bill from the previous attorney. Paul, did you want to comment on that? Or do you want me to look at
Yes.
Christine?
Rick asked us to reconsider, and so I've talked to John Lebo about it, and I'm proposing that John and I talk to Rick and go over the disputed items to see if we can get some clarity as to which area they should go. And then once we've done that, then we could report back to our respective boards.
I looked over this
to see where they want to go from there.
Paul, I looked over this bill, and when Christine brought it up, I think it seems clear that many of these charges were this legal work was generated by the clinic, and some of it was generated by the public health department. And I don't know why Mr. Boston feels that we should pay, that the public health department should pay all of this bill in its entirety. I have no quarrel with the bill. I just think that it should be paid by the people who asked for the legal work to be done.
I don't disagree, but I think it would be good to get clarity as to why he thought it should go where it was, and if we feel strongly it should go there, that he's aware of that fact. Right now, all he knows is that we're not paying it, and we think it all goes to the clinic.
In the past, his bills had been separated out, that some went to the public health and some went to the clinic. This bill, for whatever reason, hello?
Can you help us, Jonathan?
The recording has started.
Hello?
Please announce yourself.
This is Christine.
I think so.
Is everyone there?
Yeah.
Present.
Sorry, our phone connection here in the county just kind of blew. So,
Oh, okay.
sorry about that.
So what I was saying is other bills had been split between the clinic and the county. And when this one just all came to the county, I had Peter look at the bill, and he went through, and we've already paid 25.85 hours of this bill. And so what you look at, the highlighted areas are the ones that Pete and I sat down and felt like, well, these are not health department things. And some of them are like well care, things that go to well care. That's obvious, not the health department. And then some of them are Eric wanting clarification on things that the transition committee had sent. And so if Eric needed clarification on things that the transition team had sent, he's asking for clarification for the clinic, not for the health department. Does everyone understand those things, that the transition committee is the county and the health department?
Totally, but I think the clinic and our department need to talk to him and resolve this.
Right, and I feel like after I became the director, that if there was questions that needed to go to an attorney, that should have been cleared through the director of the health department.
I don't disagree. But we still have to resolve this.
Right. So
Now, this
I
is-
think
this
to
is John.
Dr. Ryder's point, having John and John Lebo and Dr. Ryder sit down with Rick and making sure that line of communication for resolution is open is probably the way to move forward. Does anybody disagree with that?
That seems to be reasonable to me. This is Jeff Butler. That makes sense to me.
Okay. So Dr. Ryder and John Lebo will coordinate a time with Rick Boston, and then you guys can have that communication with him and report back?
Yes.
Yes.
Perfect. Let's see. That was all under health officer report. I just want to make sure I didn't leave anything out from you, Dr. Jetmore.
No, I think that covers it.
Okay. Executive director report. Christine?
Yep, so we started 2 new people last Monday. One was the RN and one was the medical clerk. After 2 days, the RN resigned. Didn't feel like that was a good fit for her. Didn't really, felt a little overwhelmed with the COVID response, which I think anyone would be. This is a really difficult time for anyone to come on to the health department. They have an office built but no clinic, and so someone that's never worked in public health, trying to have them see my vision of where we'll be, in the next few days is difficult, or next few months, I'm sorry, is difficult. so she just didn't, she really couldn't buy into the vision of what it would be, and she was very emotional about it and felt horrible that she wasted our time, and I told her to not worry about that we do want it to be a good fit. And so we're back to square one, needing an RN. We have reposted the position and have gotten one application in for it. I emailed Pam Hicks to see if it was okay for us to do some different kind of advertising for it, like posting on our Facebook page. I don't know what the county rules are for certain things, and so I didn't want to post that on our Facebook page if that's kind of against county policy to do that.
My understanding it is not, but we need to make sure that the EEOC tags are on there on social media, because Facebook will shut those posts down if those things aren't on there.
Oh, okay. All right, so I just want to make sure that we can do that properly and get a good RN, that's looking forward to public health. It is hard to paint that picture, especially since our phone interviews, I wasn't able to meet with them in person. It was all over the phone. So it was a difficult field, but our medical clerk is really excited and doing a great job. I've got her enrolled now to become a insurance navigator. So when we do open the SSP back open, we'll have a navigator on site that can work with that population. And so she's really excited and is hanging in there in a really difficult time to bring someone into public health, which kind of leads us into our next thing. The architects have been to the health department to look at the build out and how we'll reorganize that space to build the clinic that we need. And they've kind of told us, realistically, that clinic will be finished maybe by the end of summer. So we're going to miss that June 1 deadline of not having. So June 1, we don't have public health offered out of the clinic, and all of that comes to us. So when I'm thinking about that, I'm thinking of temporarily having the emergency generator routed through the garage and putting the clinic storage of their vaccine in that area, and setting up the multi-purpose room as a temporary clinic. So we would partition it off with screens and different things like that. Or maybe, I'm not really sure. I would probably want some advice from you guys.
Have we suspended all of the STD testing and for foreseeable future?
We're looking at opening all that back up May 1st.
May 1st? Okay. Are there any other partners in the community that we could work with as far as urgent cares or other physician clinics that we might be able to work with on a temporary basis at least?
For immunizations?
Well, any and all, I guess I would. Immunizations, STD.
It's difficult with our immunizations. We can always ask other people, can we, send our clients to you for testing and things like that. The services for immunizations is difficult because of the stock and how do you get your vaccine, and it all comes down to money. And we can't just turn our stock over. The VFC, the Vaccine for Children program, is very protective of their stock.
Understood.
And so they don't let you just give it out, and you do it like that. It's not that simple. So they don't want us to release our control of it because our controls are very, there's a lot of guidelines that we
Gotcha.
followed.
There's
in order
tracking
to-
and inventory
yeah,
tracking
yeah,
and everything
yeah,
else. I get that.
yeah.
Okay. Anybody else have any questions, suggestions, comments? Is it possible to use one of the upfront offices as a exam room, patient room, that we would be able to at least have one room if they need a vaccination on site, we're able to do it in there?
That's what I'm thinking of, the multipurpose room.
Okay.
And just putting screens and having two places where they could do immunizations.
Okay.
But the big thing will be to get the generator. I can't bring vaccines in without, CDC approved storage for the vaccinations. Where we give the shots, I think we can stumble along for a couple of months, with it not, the clinic still getting opened up. That isn't, it's my vaccine storage is what I'm worried about.
And we've already contracted, and help me with the name, VaxCare, or is that right, VaxCare?
Yeah, VaxCare.
To be able to do the billing. So is the MPI number been switched over to the new address? Have we gone to the registry and done all that, or do they take care of that for us?
Yeah, that'll be fine.
Okay.
That will be fine, and as soon as I have an RN, then I'll move our DFC program over.
Okay.
But I started that with the last RN, and then I had to stop it when I don't have an RN. So.
We might, this Paul, we might want to look into if we can just hire a part-time or temp nurse or LPN that could just do immunizations as a stopgap.
And
Where would you find that?
I don't know if Ivy Tech or any of those resources would have. I know the state's made some provisions with other healthcare professionals that once the institution said they've graduated, that they're activating their licenses immediately. So I don't know.
The problem is I still need an RN to run the immunization program. I can do the administrative component of it, but I can't oversee. I need that RN. I have to get a full-time RN in here and then we can bring in temporary staff and all of that to run through, shot clinics and drive-through testing and all of that stuff. But without that RN, we're stymied, to move forward on the actual running of that. It's something that you have to have an RN to do that.
On the testing, did our CLIA waiver transfer over to the new location?
We've filed for that.
We filed for it.
Yeah, we
Okay.
filed for our own, but
Just curious. I'm hearing horror stories.
Yeah. Yeah, we've already started that process.
yeah.
Okay.
So, but I just wanted everyone to know that June 1 deadline is looming at the forefront of my mind of how do we get this done, with all of this, everything going on. I mean, it's a crazy, absolutely crazy time in public health. And it's difficult to bring someone on. I'm very happy with our medical clerk that we've brought on, but kind of the deer in the headlights with that nurse, I knew it was going to be difficult. It's our situation is difficult to bring someone into, and then you put COVID-19 on top of it, and it's just a really difficult time in public health. So.
And the medical clerk is doing some of the case tracking. This is kind of out of line with the agenda, but what is the process that we're going through with case?
So we did have a retired RN that has volunteered her time, and she comes in and starts the case investigation for any COVID positive. So she makes that initial contact, and the kin contacts if they're an intubated person that can't speak to us. And she gets the case investigation going and gets a list of their case contacts. Those then case contacts are turned over to Melissa, the medical clerk, and she makes those contacts and explains the isolation period and the quarantine period, depending on how close of a contact they are.
Any other questions for Christine on positions, new positions that the one new position, the one that moved on, and the clinic build out?
Will you still be, clarification, after June 1, will you still then have folks in the current health center building? Are you saying you're going to try to relocate them temporarily into the new building?
Who in the... It was my understanding, the way it's been explained to me, June 1, the clinic will not be doing any public health. So they won't do immunizations and stuff. So as far as I understand, I as of June 1, I have no access to any of them.
And none of them will be public health employees?
Right.
All right. So the answer to my question is yes, public health will be out of the current clinic facility, the building, the health building.
Right.
At June 1, it's just that we won't have permanent facilities for them in the new in the Molino building until sometime late summer.
Right.
Okay, I can work with that.
Are there any employees that are working out of the clinic today that will be public health employees after June 1st?
No.
Okay. Any other questions? Old business?
I think we've covered everything on the COVID-19. And then there was talk about the funeral directive that Dr. Jetmore issued in March.
Let me address that. Our directive was fairly simple, that there would be no services in the funeral home, and there would be no more than 5 people around the gravesite. The reason we did that, and I'm very proud of that directive, because the people we're really concerned about in this outbreak, the people that were dying, were older people and people with comorbidities. And so we're very concerned about nursing homes, and we were very concerned about that particular group at funerals. They're older people. The people that have died are old. Their friends are old. Now, this didn't mean that you couldn't have more than 5 people at a funeral. It's just that visiting that around that gravesite, I didn't want 20 people gathering, weeping and hugging one another around a grave. I realize that this is may seem draconian to some people, but but it's necessary in a dangerous epidemic like this. Now, having said that, people have pointed out that the governor has said that there could be 10 people at a graveside. Now, I have to say, these numbers are numbers that are not, you notice all these numbers are always round or even numbers. I mean, nobody's done a double-blind study of graveside gatherings and compared the results. So these numbers are snatched out of the air. Mine was, and so was the governor's. But I think that we're getting signals from the governor that he's going to start trying to loosen things on May the 1st. And in that spirit, Christine and I are going to issue a news release that in a week we will go to 10 people around a graveside, with the caveats that people still respect social distancing and all of the other things we asked them to do in the original directive.
That was also to give us this week to watch the numbers.
Yes,
Yeah.
if the numbers go up, then this whole thing has to be reconsidered. And one of the things I want to say as an addendum to that is we've seen what happens when, the classic example is the country of Singapore, which along with South Korea was considered a model for controlling coronavirus. Everybody that came into the country was tested. They had plenty of tests. They had plenty of PPE. They tested everybody. If they were positive, they traced down every last one of their contacts. They isolated them all, and they got down to they had no reporting of any coronavirus. So they relaxed everything, and now the incidence of coronavirus is doubling in that country every 2 days. And I think we will see little outbreaks all across the United States as we ease up on these restrictions. We have to be very, very careful, because the paradox of public health is if you're really, really good at it, people say, well, why did we need that? I mean, we don't have any sick people here, which was your intent when you started out. So that's all I had to say about that. I'm done talking.
Right,
Pete?
and no, go
Excuse me. In that regard, the commissioners would respectfully request to at least have copies of the directives. I think it's important that the executive body of county government and public health be speaking as early as possible from the same page and with a common understanding. So I don't know, I know they're not necessarily formalized like a resolution might be, but if they've been email transmitted or whatever, and I know you got other things to do, but I don't know that you've done that many to begin with, so I don't think it's going to be terribly burdensome for somebody to find the emails and get them to Beth Fields for the commissioners and future ones going forward. I think everyone, the commissioners, support what you've done and understand it. At least that was.
Well, I agree. I think communication's always important, and the more transparent you are, the better. And in the future, we'll make sure, and hopefully won't omit anybody that needs to see these directives.
but I would like to say that we did. I mean, this was talked about, and it was upheld in that first joint directive that was issued. Because I sat in about that chair right there and was asked in the thing directly about the funerals that was in where they upheld all of the directives of the health department. So it was discussed with the commissioners.
I know, but he's specifically asking that we email him the directive, and we'll.
Whatever form those directives take, just share it with the commissioners.
But those directives were endorsed by the commissioners and also the mayor, if I remember correctly.
Well, if you're talking about the press conference, it was held on a Friday, March 20? I think so.
Seems like 100 years ago.
The joint executive order that emanated that day from the mayor and from the commissioners, from actually the president of the commissioners, that was then endorsed that next Wednesday by the full commission. Yes, those were understood.
Okay.
I didn't know to what degree they reflected direct input from the health department or not. These were just matters that had been, I know they'd been talked about. I wasn't involved in that process. I can't speak to that.
Anything else, Dr. Jetmore?
No. Unless there are questions from anybody about.
Any questions or comments from anybody on the call
Pete,
first?
Pete, this is John Eagleman. I wanted to make a couple of comments on behalf of the cemetery. If you are going to allow 10 people to attend the actual burial at the burial site. Remember that during inclement weather, we put up a tent that holds a bunch of people, but if you crowd 10 people underneath one of these tents, into one of these tents because of the weather, there's no way those people can stay separated from each other. That's going to be very crowded. That's one thing you have to think about if you keep that limit of people attending to 10. The other thing I wanted to mention was we had a funeral last week where we buried a veteran out on the veteran section, and permission was given to the people who were next of kin. Permission was given to have the actual funeral service at the burial site, which meant that they were given permission to have the casket open for a short period of time at the burial site, which is not normally done. The caskets are normally closed at the funeral parlor. In any event, the casket was opened, and permission was given for 10 people to be there or so. It was in the veteran section, so it was a wide open territory. There was no tent or anything like that. But there were many cars that were allowed to come as long as the people stayed in the cars. Problem was that during the ceremony, the cars emptied and the people poured out into the area where the burial was taking place, so that there were dozens and dozens of people packed around the casket, some of them hugging the casket, some of them kissing the casket, some of them so there was unbelievable close contact. Now that's the kind of thing that you can't control. There really was nothing more we could do about. At the cemetery wasn't anything we could do. We couldn't very well call the police or call the sheriff or whatever to round these people up and tell them they couldn't do that. So I did want to point out just a couple of problems that we have at the cemeteries.
And my understanding is the directive doesn't limit folks in the cars in the cemetery at all.
No, and 5 people can come to the grave, and then another 5 can come. It's just, this whole thing, this is a blunt weapon, social distancing, but it's the only weapon we have to stop the spread of this disease. We have nothing else. We have no vaccine. We have no really good, fast, reliable testing. People can be asymptomatic, feel perfectly well, and be shedding virus all over the place. So we can't even tell clinically who has the virus in many cases. So I think this is a tough situation, but a necessary one.
These are the gut punch decisions that have to be made in public health. And, in my 20 years of working at local public health and sitting around and doing pandemic planning and emergency response, these are the things that we wrote in. And we all sat around the table and said, wouldn't that be horrible if we had to make those choices? If we had to tell people you can't have a funeral, that would be horrible. I hope we never have to do this. And for 20 years, I hope that I'm retired before we ever have a situation where this decision lands on my desk. And it did. It landed on my desk. And the decisions had to be made, and they were tough decisions. Dr. Jetmore and myself, countless hours that we had discussions. They were not made lightly. With Ken Paust, with Denny, with Jeff Plaster, lots of talks were done. So to anyone that thinks that these decisions were made in a vacuum or without talking to other people, other counties, Wayne County is not the only county that has restrictions. We restricted ours to 5, feeling like this would be a good way to limit the amount of people. The spirit of the directive is to limit the amount of people that are coming out and going to funerals. That's the spirit of the directive. Delaware County, conversely, I lost my mother-in-law, And they said they want 5 people at the gravesite. More can be back, axillary to that, but you cannot be at the gravesite longer than 10 minutes. So they limited, instead of the numbers, they put in numbers in there, but then they limited the duration that the people can be in close contact with each other. So Wayne County is not the only one out there trying to tackle how do we keep people safe in times of mourning and still allow Americans to mourn the way that we do. And so it's a tough decision that was made. It was a tough directive to put out there. It's been a tough directive to talk about. I don't think that anyone's comfortable with limiting anyone's freedoms. But these were the decisions that had to be made in public health. The directives that come from the governor are directives and our guidelines that we did. We not only took our funerals to 5, but we came out first in Wayne County to put the directive of when they closed down dining, that we didn't allow people to go in even to order. It was curbside from the get-go. And then you saw the state of Indiana catch up and be more like what Wayne County did from the get-go. And so when you look at the numbers surrounding Wayne County, we're lower than all of them around us. And it's because we came out early and we came out strong and we came out clear with our directives. They're hard directives. They were not fun. No one more than me wants these directives to be lifted. My job would be so much easier when all of this is over. So I'm the first person that wants this to be all over with. So I just wanted to...
I think it's important to note we border Ohio, and many of our directives mirror also
Yes.
what Ohio has done also.
Right.
So we're weighing Ohio and Indiana.
Right.
So, any other comments or questions on the call?
I've got one question. I asked Dr. Ryder the other day. We're 45 days from not having a clinic in Wayne, a clinic. Has anyone heard? Are we going to have an announcement to say that Wayne County government is out of that business June 1st? Or has anyone heard how have they gotten their approval? Do they have a FQC?
Bob, John Lee, we do have that approval. We are now a fully qualified health center again.
Okay, good. Now, are we going, or is it necessary? I'm just asking the question because there's going to be a lot of people thinking they're going to the Wayne County Clinic on the 2nd of June, and it's not the Wayne County Clinic.
That might be something with John Lebo and Dr. Ryder as they have that conversation with Rick Boston.
Yeah, we will discuss that.
Yep. If you don't mind, there's...
I know initially Christine made the announcements relating to that we would be separated and still in business and you guys would be moving. She went through that, but we need to go and rehash it.
Okay. Very good. I'm going to go back to the funeral directive for just a moment. We have a gentleman here in council chambers that wanted to ask a question, I assume?
Thank you. I'll be brief.
No, that's fine. If you could please state your name, just so...
My name is Keith Webster. I'm a funeral director in Fountain City, Indiana, and I have a graveside service at 1:30 today, so I will be brief. I'm not here for a green ribbon. I'm not here to make funeral directors out to be more important than they are. We are part of the continuum of care in this. We're death. We're not life or death. We have a thick book of guidelines from the Indiana Code that we have to follow. Terminology like graveside service, funeral service, memorial service, they mean things. I have sat here today hearing 5 but it can vary. Okay, I have asked for documentation of that, as have other funeral homes, to show their families, and I received these 2 copies yesterday, which are the first time I've seen them. And one is under your signature. The only place I see the number 5 in here is in the phone number to the health department. It states, all in-person funeral services for the public are suspended until further notice. And that was the headline that our media ran. Okay. No guidance to numbers whatsoever, and that's what we have been asking for. To that point, I emailed to the health department, to the health officer, a proposal on March 26th, spelled out. And I've gotten crickets, with all due respect. We will follow guidelines. We're more than willing to do that. We need policy in real writing, in the form of resolutions drafted by an attorney on a letterhead to show people. That's all we're asking for. And if it's 5 people, it's 5 people. If it's 10 people, it's 10 people. We're not asking for everything to be lifted. But we are asking for some help. Help us help families. Please. That's all I have. I really need to go. I wish I could stay more. I'll leave these here. I would love to hear from you. I would love to have input with you when you're drafting these policies. We deal with mass casualty incidents on a not so regular basis, but we do have experience in those things. And I would consider what we're going through right now a mass casualty incident, or the potential there. So I'll leave these with you, and I thank you for your time.
Thank you.
So what specifically was that proposal?
It's on the top of the page. It's on the top page there.
We will get that emailed out to everybody after the meeting.
I've been in communication with them. I've had emails back and forth with them, so.
And if I remember correctly, this goes back to March 12th, maybe 14th, somewhere in that.
March 12th.
12th, when we're way early in this process trying to figure out what to do. That was the day that we had the discussion about the schools with the superintendents in the room. There was a meeting with superintendents before that, and there was a meeting with funeral directors that day, if I remember correctly.
Yeah, that's right.
So, okay. Anything else? Let's see. New business, emergency SSP plan.
So that's Chris. I've given you a copy, and I emailed everyone a copy of this. Like Chris said earlier, the state is looking to give directives to open up SSPs May 1. And when we reached out to Centerstone, they're not looking to open their facilities back up May 1. So there's an emergency plan to move the SSP to the health department's building. And there is a map in your packet that shows you how we would bring them in. It would be through so there's the main door to enter the health department, and then there's 2 side doors heading toward the garage door. They would be brought in through there. The garage would be utilized as kind of a staging, and then in through the garage into the SSP or the HIV hepatitis area where they would get their services. We would have immunizations in there, and then we already have a counseling room set up for the CLEAR program that they would use if they need to have HIV and hepatitis C counseling. But it would be moving temporarily the SSP to our building instead of the Centerstone.
And just for the folks that may be watching, SSP is the Syringe Services Program or the Syringe Exchange Program.
Right.
So,
Chris, if you want to come up, and he knows, Chris is my right and left hand when it comes to those programs. He has been running the program for several years for Wayne County, so.
Yeah, I'm Chris Simons. I'm the HIV hepatitis program manager. Basically, all we're asking is just for a temporary Band-Aid for right now. Just a quick solution. We know that drug usage is going to increase with people with depression right now. So let's try to fix this while we still can.
at least keep it safer.
Yeah, keep it safer.
Right.
And right now, these people aren't getting any type of substance abuse counseling,
Right.
any type of additional services. And without us having that interface, we're leaving it up to them. We all know historically, drug users don't tend to do things on their own when it comes to medical and reaching out for those additional services. So that's what we're looking at, is bringing on the harm reduction program back into full force, so that way we can start helping with those steps so we don't fall further behind.
Yeah. And then we would follow ISDH's guidelines on how to as safe as we can, offer the syringe services to protect our employees and protect anyone that we're serving through that program as well. So masking anyone that's coming in and different things like that. So we would follow ISDH's guidelines on that. We've talked about working with Reed Hospital to be able to help them get services if they are showing symptoms or feel like they need to be tested for COVID-19. We would then also be a resource to link that population into getting services even for that.
So we're looking for a motion to approve the plan to start May 1, following the guidelines from the Indiana State Department of Health and the emergency plan that's proposed, that was emailed out to all of us.
Yep.
This is Paul Ryder. I so move.
Jeff Butler,
John
second.
Lebo, I second.
So we got Paul Ryder motion and John Lebo second. Any questions or comments? Hearing none, we'll do a roll call vote. Jeff Butler,
Aye.
Robert Coddington,
Abstain.
John Eagleman,
Aye.
John Lebo,
Aye.
Sabrina Pennington,
Aye.
Paul Ryder,
Aye.
Peter Zaleski, aye. Motion passes.
Okay. Thank you.
Death certificate.
Death certificates.
I asked
Yeah.
Christine to add this to the agenda because I wasn't aware of this. These death certificates, there's a fee for getting a death certificate. And apparently, we've been, the Board of Health is going to have to consider this and make a decision, obviously, but the nursing homes get these death certificates, and apparently we've been doing their bookkeeping. We let them. What did I say?
Nursing.
Oh, I meant funeral home. I'm sorry. They pay maybe monthly, or then our people at the public health send them emails of how much money they owe at the end of the month. And I think when they get the death certificate, they should pay us, and that's that. I don't want the people working for us doing bookkeeping for the funeral homes. And then a final thing, someone told me that certain people would get, if they work for the county or knew somebody, they get their death certificate for free. there should not be any free death certificates. If I need a death certificate as the public health officer, I'm going to pay for that death certificate. Christine, you're going to have to pay for your death certificate if you want one, and that's...
I had to pay for my mother-in-law's.
All right, so no free death certificates, and we need to put an end to this kind of running billing for these death certificates. Those are just my thoughts.
I will say, I didn't know anything about the ledger book, the bookkeeping book for funeral homes either until recently, and it kind of took me back. I've worked at other health departments, and I've never seen our staff being the bookkeepers and the clerks for individual companies. And it bothered me because when we were starting to separate out from the clinic and move over to our new building, and I needed people to do certain things, like I need someone to do claims, I need someone to do payroll. My staff's first thing was, I can't do anymore. I'm too busy. I've got other things. But if I have someone keeping the books for funeral homes, and they can't keep books for me, that's a problem. I need my staff doing my work, not the funeral home's work.
And we're able to take credit cards at?
Yeah. Yep.
And
I couldn't agree more. We're not in the billing and receivables business. We're in the service business.
correct. Ron, on fees, usually fees come as recommendations from the board that then go to the commissioners for approval. Is any part of that allowing for waiving of the fees discussed as part of that the commissioners approve?
I'd have to look. I think Christine provided me the last update of the fees, and that was in 2014, I think, wasn't it, Christine?
Mm-hmm.
Right, but is there ever that caveat of these people get free and?
No. That's probably a practice that developed in silencio, so to speak, without anybody ever really approving it, that I'm aware of at least.
Okay. So it'd be up to this board to put a stop to that, and I don't think that would necessarily need commissioner approval after that.
Well, no, I think the fee is the fee, and if you're charging it, then I think it makes good sense to collect it at the point of sale, which is you folks.
Right.
And not have to allow a third-party vendor to utilize your resources to be billed.
That's correct.
I know I personally had an experience, and I complicated because it's an interstate situation, but on the locals, on the bill I got from the Kentucky Funeral Home, there was a provision for $50 for death certificates. Well, I know the Kentucky Funeral Home didn't have access to them because my mother died here in Indiana. So I don't know. I don't understand how it works. I'm learning too as we go. But I think Dr. Jetmore's point's well taken. Bill them or collect them at the time you issue them, and take credit cards. So be it.
I know that when we were getting my mother-in-law's, the funeral homes had said that they would take care of getting the death certificates. I said, well, how much are the death certificates? And they said they're $25 a piece. But it's a lot easier for us to get the death certificate for you, which I know how easy it is to get a death certificate. And they charge $15 in Delaware County, so that funeral home is charging $10 extra for simply getting the death certificate for the family as a convenience for them. So.
I would be in favor of just stopping the ledger book, but I think there needs to be communication with the funeral homes, and to do that, say, today,
Right.
I would rather it be a future date, so there's an understanding that May 1, June 1, whatever that date is, then we'll no longer take, we're not doing the bookkeeping. We can cash your credit card or check.
I would agree that June 1 would be a good date. We'll put out that they need to be paid up by June 1, and then moving forward, it's a fee whenever, if you order 6 death certificates, you'll pay for the 6 death certificates at the time of pickup.
Does that seem agreeable to you, Dr.
Yeah.
Jetmore?
Yeah.
So that way there's a lead, it's not a complete cutoff.
Yeah, I think it's right. I think they need some lead time, and this will give them plenty of lead time.
And then as far as the comping of death certificates, I think, I don't see any reason for that practice to continue.
I can't find anything in writing that says who gets free ones. It's not even a policy. It was just kind of a,
It's the way it's always been done?
yeah, if you say the right words or you knew the password, you got a free one. I don't know.
Okay. Is there a motion that anyone would want to propose?
Well, this is Dr. Ryder. And I'll move that we end the practice of complimentary death certificates, that all death certificates be paid for at the time that they're issued, and that the implementation date for funeral homes be June 1st.
John Eagleman, second.
Dr. Ryder made the motion, Dr. Eagleman made the second. Any comments or questions? Hearing none, I'll do a roll call vote. Jeff Butler?
Aye.
Robert Coddington?
Aye.
John Eagleman?
Aye.
John Lebo?
Aye.
Sabrina Pennington?
Aye.
Paul Ryder?
Aye.
Peter Zaleski? Aye. Anything else from anyone on the board? Christine?
Nope. Thank
Dr.
you.
Jetmore?
Nope.
Ron? Would entertain a motion for adjournment.
You need to set a next meeting date.
Oh, next meeting date, sorry about that. Thank you.
You want to go a month out? Keep them at 2 weeks.
2 weeks or a month out on next meeting date?
That's Dr. Ryder. I think we need to go 2 weeks, and I think one thing we really need to consider is how we're going to carry on with public health after June 1st. I mean, I think we're going to have to look at various options. Does it mean leasing people? When they look at hiring people, but we've got to come up with a plan. And time's running out.
Yep.
I agree. So we're looking at Thursday, April 30th at noon. Does that seem agreeable?
Yes.
Very good. So we'll get minutes out prior to that meeting and agenda the week before. Very good. Entertain a motion for adjournment.
So moved.
Second.
All in favor, say aye.
Aye.
Thank you. Thank you all.